I invite Dr. Kumutha ma'am to come on to the stage to talk about implementing of BFHI challenges and successes. And I invite Dr. Surinder Bish sir as a moderator for this session.
Good. Thank you, the organizers, Sushena, and the organizers of LAMBCON 2024. I'm really thankful to the organizers for having called me. Thank you, Santosh. Thank you, Murki, Nitasha. And I'm so glad that I'm be moderating Madam on BFHI, Baby Friendly Hospital Initiative. And I don't know whether UNICEF people are here or not right now, but I have certainly made a pitch early in the morning with UNICEF this region to actually do more of BFHI certification along with NNF certification to all the units.
Good evening. At the outset, I would like to thank LAMBCON organizers for giving me this opportunity of pondering on baby-friendly hospital initiative. So, to know a little bit about the history of how it evolved, in 1991, a launch of baby-friendly hospital happened across the globe, and in India, it was started in 1992. We all had 1 week training, as Dr. Bix said. It was funded by UNICEF, and lot of hospitals across the country got certified as baby-friendly hospital. The goal of baby-friendly hospital initiative was to promote breastfeeding practices in the hospitals, both in government and private. Note it, this is not an initiative only in the government sector, but also in the private sector. And the key intervention towards achieving reduction of infant mortality. And also to remove the food samples, that is tin and all that samples in the hospital. Before 1991, we had lot of samples being pumped into the hospitals and mothers, and also in the doctor's clinic. They will dump us, and if the companies, if you promote baby food, there were lot of gifts like refrigerator, foreign trip and all those things, and so that got regulated because of the baby friendly hospital initiative. And also in 2002, the World Health Assembly came with the current guidelines of 4 points of IYCF, that is early initiation, exclusive breastfeeding, continuation of breastfeeding along with complementary feeds beyond 2 years. So those are the recommendations which came in 2002, but this baby friendly hospital initiative recently revised the guidelines. The WHO revised the guidelines in 2018. So we expect positive impact. All of us know from morning we've been talking about the advantages of breastfeeding, and you know, just early initiation within 1 hour can reduce the mortality of neonatal mortality by 22%. We know that. And again, we can prevent under-5 deaths also. And also we will have lot of economic benefits. So all this, despite knowing this, what is happening to this baby-friendly hospital initiative, we will see all the efforts which went between 1992 for 2, 3, 4 years, we went on designating hospitals as baby-friendly based on implementation of the 10 steps of baby-friendly hospital initiative. We will see what happened over years. So the BPNA assessed the impact in 1999. I told you we started in 1992. After 7 years, they found that early initiation improved from 36.5 in non-BFHI hospital to 54.5. You can see here, the pointer is not working. You can see the graph, the first bar, the blue. And also reduction in prelactal feed use and breastfeeding discussion during antenatal period also improved in BFHI hospitals. And the training impact, again, in the BFHI hospital, the breastfeeding practices also improved. But if you look at across the IYCF indicators, that is early initiation, exclusive breastfeeding, appropriate complementary feeding, you look at 3 surveys which has happened across the country. We have National Family Health Survey every 4 years, and I am going to compare 3, 4 and 5. And you can see the 3 bars. The first indicator is early breastfeeding. You see, despite all this effort, we have not made any dent in early initiation. From NFHS 323 to 41, we have gone, but from 2005 to now 2021, early initiation has not improved. But the institutional delivery rate has improved. Our Indian institutional delivery rate is 88, and some of the states like Tamil Nadu, maybe even Telangana, we have very near 99% institutional delivery. Even in Tamil Nadu, where we have 99% institutional delivery, if you look at our early initiation, it is only 50%. It is 60%. So we have, where is the problem? The babies are being delivered in the hospital, but early initiation, which is in our hands to be implemented, is not getting implemented. So that is the problem. And then if you look at in NFHS 4, which are the states which are doing very well? The only state which is doing very well in that green color is Tripura and Meghalaya. All the rest of the states are in yellow, and Odisha little better than other states. And there are even some states like Rajasthan, Uttar Pradesh and Bihar in red color. That means our early initiation, all the indicators are less than 40% in these states. So we should know where we are standing. And again, if you look at in the current NFHS 5, these are the states, only one state where the expected should be more than 80%, that is only Lakshadweep and Meghalaya. All the other states are having less than 80% early initiation. So that means that is a status in which we are implementing IYCF. We always feel, I am a very good hospital, all the patients who come to my hospital get the best of treatment. But if you look at this, it is not reflecting in the survey. So please, we should see that all these indicators are monitored, which I will be talking little later. And again, impact of BFHI practices done by Anne et al. If at least, even if you practice 1 or 2 or 3, 4, the decline in stopping breastfeeding is coming down. From 30%, we can bring it to 3%. That means 97% mothers would be breastfeeding their children if we adopt all the 10 steps of the baby-friendly hospital initiative. Okay, what are the challenges in our country? See, we have certain cultural beliefs. As somebody was saying, even in the previous, I think Dr. Sushma was mentioning that pre-lactal feeds are still being given. But I think about 20 years back, what we had in Tamil Nadu, we are not having, except for the odd parent gives pre-lactal feeds. But there is low awareness, lot of low awareness regarding the IYCF practices. That we have to dispel by training and supporting mothers. And inadequate training in the health workers. I want to ask one question. In your hospitals or in your system, within 2 years, how many of you had training on IYCF? Can you put up your hands? Within 2 years. Out of 100 people here, there are only 3 people who are putting their hands. And so that is the status. We are not only supposed to have pre-service training, but also we should have in-service training with the newest guidelines every 2 years, and we should be assessed for it. So that is not happening. Then workload and of course time constraints, we will see, because in IOG, in ICH, I think there are 30 deliveries in a day. In Nilafar, again 30 deliveries every day. So there might be a lot of problem in HR, that is human resource, and funding and infrastructure. Actually, after the UNICEF funding stopped, Government of India did not spend any money on baby-friendly hospital initiative till in 2016 we initiated MA program. Till then, nothing was funded by the Government of India. And also we have aggressive formula marketing. We know between 1990 to now, we have got so much aggressive formula marketing, but thanks to IMS Act, At least we are not having it in the TV and the print media. Otherwise, earlier we used to get all Bonnie babies, all companies putting their tin, and not only that, giving one katori as a free gift, and all that ads used to come, but that thanks to IMS Act, those things are not coming. But what is, everything is it so bleak? There are certain successes. So we have now national advocacy efforts after 2016. Though we had in between IYC by the Ministry of Health, we have now MA, that is Mother's Absolute Action Program, which has been launched by Ministry of Health and Family Welfare in 2016. We have that. And we also have policy support of Infant Milk Substitutes Act, which was revised in 2003 when the President was Abdul Kalam, our Honorable Abdul Kalam sir, where the ambit of infant milk substitutes moved from only milk substitutes to even the complementary feeds up to 2 years. There was some change there, and certification of baby-friendly hospitals are now being done. And I would like now Surender to take active part in redesignation of baby-friendly hospitals as part of NNF. And though there has been not much of change, if you had looked at the exclusive breastfeeding rates, there has been some improvement when compared with NFHS 3 to NFHS 5. Only our early initiation is less, but our exclusive breastfeeding rate has improved. So these are the successes we do have, but there is a lot of action to be done. As I told you, MA program was started by Ministry of Health, and they did 3 things. That is, at the macro level, they did lot of advocacy using mass media and print media. And you should have known, may I know who are the government hospital people here? Government hospital? Did you have implementation of MA program in your hospitals? She doesn't seem to know, but we should have done it. And MISO at the health centers and doctors and nurses, and at the micro level at the community with the Anganwadi worker, ASHA worker and the ANMs. So at the 3 levels. And what beauty of this MA program is, baby-friendly hospital is only at the hospital level. But MA program also connected hospital and community in breastfeeding promotion and protection and support activity. So that is what we have to follow. Please go through the guidelines of MA program. You can download it and you can follow it in each of your hospital and follow it up with the community linkage. See, these are so much posters are there for you to be downloaded. It is both there in Tamil and English. You can also have local translation. You can download it and use it. Flip charts, toolkits, everything is available in the website. And again, if you look at the baby-friendly hospital initiative across the globe, WHO did a survey, that is Nutrition Policy Review in 2017. They looked at 194 countries. You see, again, the implementation was very poor. Again, what were the challenges? Sustainability. They all started, but they were not able to sustain their efforts because funding, infrastructure and HR was not there. And also reassessment never happened, monitoring did not happen, and many of the countries did not implement the international code on infant milk substitutes. So these were the challenges they found. And if you look at India, they have, in that survey, they have said India does not even have one hospital where deliveries are happening as certified with all the criteria now being fulfilled. That is what is their data report. You see here, the last CRO country, India, reported percentage of births in designated hospitals and maternity is 0. That is their survey report. So this slide I will not go because I will be repeating it later. So again, BPNI also did a World Breastfeeding Friends initiative for India, and they have given 0 mark for baby-friendly hospital initiative because the implementation is not at all adequate, and we have not scored anything at all. And we should know the revised ones. See, all of you know the 10 steps. Please, anyone knows, all of you know what are the 10 steps of baby-friendly hospital? I'm seeing lot of nods and hands. Very good. In 2018, they modified in many steps, about at least 4 steps. Number 1 step they added was, they wanted to have a first feeding policy that is communicated, and also they wanted monitoring and data collection. So we should have in the hospital data collection about our early initiation, what is the support given, all that we should start collecting. And the next change was help mothers initiate breastfeeding within the first half hour. They said it is not only early initiation within 1 hour, early skin to skin contact immediately and at least for 1 hour. Extended skin to skin contact for at least 1 hour. It can be more than that also. So how many hospitals are doing early skin to skin contact? Early skin to skin contact? Only 4, 5. Early skin to skin contact, please do. It's an important intervention which we have to be done. No, only 6 hands came up, Srinivas.
People are not willing to raise a hand. They are so tired.
Okay. Again, earlier we used to say demand feeding. Now we are talking about responsive feeding and cue-based feeding, which has been spoken so much from morning. And again, in the last one, having mother support group, we should, whenever we discharge a patient, it is our duty and responsibility that we connect her to a community person. Please, everyone who is coming to your hospital will have a mother and child link card. In that card, the ANM's name and her phone number will be there. Asha's name and phone number will be there. So whenever you discharge, please all the nurses call that woman and say we are discharging so and so baby. It is not only baby from SNCU or NICU, you should inform even all the babies who are getting discharged in the postnatal ward. Okay. So we have certain monitoring devices also which we have to do. I will quickly run through. We should look at 80% of the health personnel should have. So please do periodic auditing. Don't do it every month, at least every 3 to 6 months do this auditing. In stage 2, you should look at how many 80% of the clinical staff should know. And again, key indicator you have to collect. And all this, there are global standards given, because for want of time, you can save this slide if anybody is interested, and I will leave it. I'll quickly go through this. Global standards are given for each of the steps. And we did, again in Tamil Nadu, we were the first state to do this State Breastfeeding Trends Initiative. What is the support given? We got 64, and even in breastfeeding baby-friendly hospital initiative, the second one, we got only 4.5. We are supposed to be a progressive state. Still, we did not get adequate points there. So what is the need of the hour? Now, we should know that we have to redesignate and follow these 10 steps properly. Please, somebody in the hospital, take initiative and look at the 10 steps, whether policy is displayed, whether we have done the training, whether we are looking at all the key support clinical indicators properly. All that has to be done. And please go for redesignation by yourself. You look at your own hospital and see whether it is being done. And actually BPNA has come with 6 tools for closing this gap. You can use these tools except for 5 and 6 which are paid. 1 to 4 are easily downloadable. You can also use it for assessing your hospital whether you are following all the 10 steps. And we should also have linkages with, for IMS Act, you know that who is in charge? The food safety department is in charge to monitor. But we should have from the health department somebody to monitor if there is any violation of IMS Act is happening. What is violation of IMS Act? Anybody?
Violation of IMS Act. किसी को पता है?
If this conference gets sponsored by some baby food company, it is violation. You know, if you go for a conference also, you should ask, is this conference being organized only with your own funds or funds not received from baby friendly, food industry. So those are the violations. So everybody should check all that, and there are many programs in the government which will look after IYCF, like MA program, Lakshya program. In Lakshya you have early skin to skin contact also. In Poshan Abhiyan in the community you have to talk about IYCF. And again in facility based SNCU module training also we are telling all this. Early initiation, breastfeeding and KMC. So all programs have it. Only thing is we have to implement it. So the future directions, I have only 2 more slides. So we should have wider training programs. We found that only 4 people were there. So immediately you go in your hospital and now trained. You got trained today. Please go and train. Expanding BFHI to more facilities, then community-based action. Even in a PHC, UHC, sub-center or sub-district hospital, we should enforce it. And we should also strengthen IMS Act and leveraging technology. See, in Tamil Nadu, we have got a digital platform, ECD call center. We have about 20 health officials proactively calling the women, high-risk pregnancy women and high-risk babies and babies delivered from SNCU. They talk about IYCF. So you can have programs like that where we can digitally take them and also use social media. Now young people look at social media. Please put messages, linkages in your Facebook, Instagram, everywhere. You say you attended today, we knew the importance of breastfeeding, people will follow it. So what is important for all this is funding. Funding is now given through MA program. All the states can put it in their PIP and get it. If there are any administrators, please use the funding which would be given by the Ministry of Health, and then see that you implement baby-friendly hospital initiative in your hospital and extend it to the neighboring hospitals and community also. I think that's the last slide. Thank you.
Thank you, ma'am. And for the ma'am, today in the morning, I'm really fortunate to have talked to the leadership, and very rightly said, there is no BFHI going on. In 1992, when all hospitals were getting accredited by UNICEF, the government had the funds. Now we don't have the funds. And the MA program doesn't have a certificate attached to it. You may do anything.
No, but there is incentivization attached to it.
Incentivization, there is but no certificate. So people don't get that certificate. So with you as our committee member, Jai Singh as our committee member, Dr. Keshavallu, Dr. Kanya, Dr. Ruchi, these are people who are there in the committee of breastfeeding promotion.
No, we will become more active now.
So now I request you all to make a BFHI card for at least our 300 NNF neonatal units in the private sectors where you can have that. And I think we are in the process of doing so. I request you for that. And it is not that the good states will always do good. Kerala actually showed a decline. ऐसा नहीं है कि जो कोई अच्छा कर रहा है अच्छा ही करा जा रहा है.
No, their early initiation is also not good.
Kerala showed a decline in breastfeeding rates of around 4 to 5% between NFHS 4 and NFHS 5, and more educated girls were not able to breastfeed better. In fact, public hospitals are doing better breastfeeding than the private hospitals. So there is a responsibility towards all of us, and as NNF Secretary, that all the hospitals where deliveries are occurring, especially the private ones, early initiation of breastfeeding should be done. In fact, the hand which you wanted to raise about early skin to skin may be true, which Burki is not ready to accept, because in the NFHS 5 says that public health facilities are doing better early initiation than private facilities. So I think the hand should be more raised when we ask you to have skin to skin. Thank you, ma'am.
Thank you. Sushma is saying, please come.
Thank you, Dr. Kumutha, for your insights.